Hi, everyone. My name's Cristina Shea. Can you hear me okay? So I'll admit I wasn't the first choice for this talk. My colleague Mark van der Rijn at Spaulding was asked, but is having more fun maybe on vacation internationally. But I'm really glad to be here because I think this is a really good learning opportunity for me, seeing some patients in clinic with FSHD. And so thank you for having me. I'm really glad to be learning myself from today. So as you can see here, I would call myself a neuromuscular physiatrist. My goal today is to explain what that is, and also to introduce you to the field of physical medicine and rehabilitation, which is a small field within medicine that even a lot of physicians have never really heard of. And talk a little bit about how a doctor who works in physical medicine and rehabilitation might be part of the multidisciplinary care team for individuals living with FSHD. So I personally, I work in several clinics, both at Spaulding Rehabilitation Hospital and at Brigham and Women's in Boston. And I have several different hats depending on where I am on a given day. But the common theme is that I see patients who are living with physical disability. And in particular, my interest is those who are living with neurologic or muscular disease. The goal of what I try to do is help patients improve quality of life and physical function. So again, I trained specifically in this field, physical medicine and rehabilitation, and then went on to do a neuromuscular fellowship, which is where I really learned a lot more about muscular dystrophy. And I hope today I can give you a summary of what this field in medicine is and why one might be interested in including a doctor who is a physical medicine doctor in their care. Okay, so in describing what physical medicine and rehabilitation is, I Googled it on Google's new AI thing. It's really great. And the definition was pretty good. So per Google AI, so physical medicine and rehabilitation, it's also known as physiatry. So a doctor who practices this can be called a physiatrist, or we might say PM&R for short. A lot of words and acronyms, unfortunately. But it's a medical specialty that focuses on maximizing function and quality of life for people living with physical impairments or disabilities. The definition also says that PM&R doctors or physiatrists, they provide comprehensive care that addresses a patient's physical, emotional, medical, vocational, and social needs. I should also say, I didn't mention this before, but individuals I see, I mostly see adult patients. So of course, we're not the only ones who do this. All of these other disciplines are doing a lot of this type of care as well. So certainly a neurologist, orthopedic doctors might be involved. For many people, it could be your primary care physician. And then there are a lot of disciplines within therapy as well, who we work closely with and kind of overlap in what we do. That could be a physical therapist, an occupational therapist, speech therapist, assistive technology. So this is kind of how I would describe what PM&R is to someone who had never heard of it before. And one of the things I really like about it is that we're not necessarily just diagnosis specific. Really, we see people with any diagnosis. The common theme is that we see individuals who have physical impairment. And try to work through that. So physiatrists work in a lot of different settings. Me personally, I see adult patients in an outpatient clinic setting. But physiatrists also commonly work in inpatient rehab facilities. So if there's a patient who's admitted to the hospital for some period, maybe with a medical or surgical medical issue, there might be a good argument for them not going directly back to where they were before, because they may experience some mobility decline in the setting of all of that hospitalization. And so physiatrists are commonly the physicians who are working at inpatient rehab facilities, and there's all different levels depending on what is someone's rehab needs and what are their medical needs. So that's another setting where you might encounter a physiatrist. So, because the main goal of a physiatrist is to take a holistic view of a patient and help maximize physical function and quality of life, I think there really is a role for them to be part of the multidisciplinary care for someone living with FSHD. This is a quick list of topics that I thought, yeah, this is something where a physiatrist might help for someone specifically living with FSHD, but I'm sure this list is not exhaustive. And I'm just going to touch on a couple of these things. So first of all, pain. We know that individuals living with muscular dystrophy, including FSHD, are at, unfortunately, an increased risk of living with pain. And this pain can be chronic. So definition of that meaning lasting 3 months or more. And this can have a huge impact on quality of life. There are different survey studies have estimated this could be anywhere from 50 to 80% of people living with FSHD. And the thought is there's probably multiple reasons, but at least part of that is the fact that weakness across certain joints leads to increased strain on muscles and increased strain on other joints and structures within the joint, such as ligaments, cartilage, et cetera. So common areas that people have endorsed having pain include the neck, the shoulder region, the low back, and legs. And here's an area where I think a physiatrist can be helpful because a large part of our training involves pain management. So treating pain, there's a lot of tools that we have available. It can include providing or prescribing appropriate therapy, either physical therapy, occupational therapy prescriptions, can include recommending and providing different types of bracing, as well as pain medications, which can be oral medicines, topical medicines. Can also include things like injections. So this could be like different types of cortisone shots, dry needling, and then some more complementary therapies, such as cognitive behavioral therapy, which can be really helpful because of the cognitive impact of living with pain. So we also work really closely with orthotists and brace clinics. We have a brace clinic at Spaulding in our outpatient center to provide patients with braces that can be useful either to manage pain. So one example might be using a corset or a lumbar orthosis to help with back pain and support of the core. We also very commonly prescribe AFOs, braces for the legs, to help stabilize the legs, to improve mobility and daily function. So we might be a physician who is talking about what sort of options there are for bracing, and then helping someone getting to the right place to get the right brace. So mobility aids, that's another area where we have quite a bit of training in when is a mobility aid appropriate and which type might be best for a given patient. We work very closely with wheelchair clinics and vendors. For example, where I work at Spaulding, we have a wheelchair clinic a couple days per month. And we help to provide appropriate equipment, and the goal being to improve safe mobility and prevent falls or injuries related to that. Physiatrists also work very closely with speech therapists. So that can be very helpful when individuals have a disease that's affecting their swallowing function or even just voice and voice clarity and communication. So we may recommend that a patient has some special testing done, such as this one here where you see we're evaluating swallowing function. And then we may recommend, based on that, that someone work with a speech therapist on particular exercises or swallowing strategies to either improve swallowing safety or improve clarity and communication. We also commonly work with assistive technology departments. We have an ATEC clinic at Spaulding where patients can spend dedicated time working with someone who just is really knowledgeable about assistive technology, brainstorming ways to make communicating with others easier and faster. So part of the holistic view of PM&R that I really enjoy is that part of our job and the time that we have in our clinics with patients is to look at the whole person. So spending time talking about how physical disability has implications on broader life topics. This would include work, transportation, and recreation. So very commonly, we're spending time brainstorming, helping to outline and advocate for work accommodations or connecting individuals with things like vocational rehab, if there's certain job training that might be appropriate to help them get back to work, or social work to kind of navigate the topic of working and employment with a physical disability. We are also commonly talking about transportation. So what is safe and useful transportation for a patient? We have connections with occupational therapy driving clinics, such as one at Spaulding, where an occupational therapist can work one-on-one and determine if there are certain car adaptations, for example, like hand controls that might make driving safer. And then we also focus on the importance of recreation. This is really individualized depending on what someone likes to do. But we have connections with adaptive sports programs around Massachusetts, and try to always talk about that too. So recreation doesn't always have to be physical in nature, but as physical medicine and rehab doctors, we realize that it is important to stay active to the extent that someone can, to help prevent deconditioning that can further disability. For example, when someone has muscular dystrophy. And so we spend time brainstorming and providing recommendations on physical activity that's appropriate for someone, which is really important in helping to maintain physical mobility. And then lastly, part of our holistic view, we really just want to get a sense of what daily life looks for you. So oftentimes when I meet someone, I will actually just say, like, can you take me through a typical day in your life? What are the things in your life or at your house that are hard for you or are getting more challenging? Because oftentimes there are things we can do to try to make someone more independent with those tasks. So this could be something like brainstorming home modifications, often in conjunction with physical therapy, thinking about equipment to make showering, dressing easier and safer, or moving obstacles in your living room to minimize falls. So that's just a brief overview of the kind of things that we might discuss in PM&R rehab clinic. And I hope that gives you a general sense of what we do. Of course, there's lots of overlap with a lot of other specialties. And that's one of the other big things I like about it, is that I work, kind of like one part of the big team, and communication between all these different therapists and doctors is really important and a large part of what I do. So I really look forward to chatting with all of you in the breakout session and learning from all of you today. Thanks.